medical superintelligence? The doctor is now in. That's the subject of today's video, and it's going to blow your mind. So this is brand new from Microsoft. Microsoft just introduced the MAI Diagnostic Orchestrator, an AI system that achieves 4 times higher diagnosis results than experienced doctors on some of medicine's most challenging cases, marking a step towards medical superintelligence. So let's find out exactly what happened here. The Microsoft AI team shares research that demonstrates how AI can sequentially investigate and solve medicine's most complex diagnostic challenges, cases that expert physicians struggled to answer. And these results are benchmarked against real-world case records published each week in the New England Journal of Medicine. So we're all familiar with all the stories online of how people go to doctor after doctor who can't figure out what's wrong with them. And sometimes they find out online for themselves. We're going to find out why that happens right here. As demand for healthcare continues to grow, costs are rising at an unsustainable pace. Increasingly, people are turning to digital tools for medical advice and support. Across Microsoft's AI consumer products, like Bing and Copilot, this is going to blow your mind, we see over 50 million health-related sessions every single day. Microsoft wants to do more to help, and we believe generative AI can be transformational. That's why at the end of 2024, we launched a dedicated consumer health effort at Microsoft AI, led by clinicians, designers, engineers, and AI scientists. So this is only 6 months ago, and you won't believe what they accomplished in such a short period of time. Here we go. Microsoft already has some existing solutions that include RAD-Dino, which helps accelerate and improve radiology workflows, and Microsoft Dragon Copilot, our pioneering voice-first AI assistant for clinicians. Boy, what a welcome change that is. Instead of your doctor sitting there typing the whole time you're visiting with them, now they can just record the conversation like so many other apps can, and it'll create the medical record. But this is new. In just 3 years, generative AI has advanced to the point of scoring near perfect scores on the U.S. medical licensing exam. However, that exam is a multiple choice question exam. So we focused on sequential diagnosis, a cornerstone of real-world medical decision-making. In this process, a doctor begins with an initial patient presentation and then iteratively selects questions and diagnostic tests to arrive at a final diagnosis, if they can. And then they briefly talk about the New England Journal of Medicine cases that are among the most complex in the world. So how does AI perform on these cases? Microsoft created the Sequential Diagnosis Benchmark, SD benchmark. This benchmark transforms 304 recent New England Journal of Medicine cases into stepwise diagnostic encounters. The AI diagnosis can then be compared to the gold standard outcome published in the New England Journal of Medicine. So they needed a benchmark to determine how good the AI is versus doctors. Check this out. This method allows us to evaluate performance across 2 key dimensions: diagnostic accuracy and resource expenditure, meaning how much did it cost to get to the diagnosis, which is often the cost of testing or multiple tests. We evaluated a comprehensive suite of frontier Gen AI models, including GPT, Llama, Claude, Gemini, Grok, and DeepSeek. Beyond this baseline benchmarking of these frontier models versus doctors, we also developed the Microsoft AI Diagnostic Orchestrator, a system designed to emulate a virtual panel of physicians. So what they did is create this virtual panel across multiple specialties. Orchestrators can integrate diverse data sources more effectively than individual models, while also enhancing safety, transparency, and adaptability. This model-agnostic approach promotes auditability and resilience. Now here we go with the first mind-blowing stat. So they call the Microsoft AI Diagnostic Orchestrator MAI-DxO. MAI-DxO boosted the diagnostic performance of every model we tested. The best performing setup was MAI-DxO prepared with OpenAI's O3 reasoning model, which correctly solved 85.5% of the benchmark cases. How does that compare to human beings? The expert doctors achieved a mean accuracy of 20% across completed cases. So that means that this orchestrator is 4.5 times more accurate than human doctors, thus the concrete step to medical superintelligence. And there's more. Importantly, we found that MAI-DxO delivered both higher diagnostic accuracy and lower overall testing cost than physicians or any individual foundation model tested. So this method reduced the number of diagnostic tests required to get to the correct result, and it got to the correct result 4.5 times more often than people. One reason is that no single physician can span the full complexity of these benchmark cases. AI, on the other hand, doesn't face this trade-off. The principal conclusion is this kind of reasoning has the potential to completely reshape healthcare. AI could empower patients to self-manage routine aspects of their care and equip doctors with advanced decision support for complex cases. It is estimated that 25% of healthcare expenditures are currently wasted, having little influence on patient outcomes. So this advance is extremely powerful in reducing cost. The next step is further testing that's needed to assess performance on common everyday presentations in the real world. So Microsoft is now rolling this out to actual hospital change for active testing. Microsoft goes on to say, for us, this is just the first step. We're partnering with leading health organizations to rigorously test and validate these approaches, an essential step before any broader rollout. So as I said, partnering with top hospital chains. So what does this mean for everyday folks and for you and your career? 3 things. 1, this approach shows that creating an AI-enabled management tool on top of these foundation models can dramatically improve their performance in a specific sector. So I think this is going to be the approach going forward. A tailored AI specialized in healthcare, coding, whatever it is, paired with a Gen AI foundation model. So that's number 1. Number 2, we are approaching the age of specialized superintelligence, which will arrive before general superintelligence. What does that mean? That means that specific fields now are going to be very quickly, dramatically improved. How do we know that? This extraordinary result of a 4.5 times better than human medical diagnostic approach was accomplished in only 6 months. Now you take that to other fields, on a similar timeline, and you can see that by 2030, virtually every major human endeavor is dramatically improved. Dramatically improved. This is a foundational change in the world and not an exaggeration to say that. Clearly, as these super intelligences are developed and proven and rolled out, it will affect work. It will affect work in two ways. Initially, the first way is all the drudgery will be removed from jobs through automation. Everything that's routine task work will be completely automated. Humans are then there to interact with and guide the AI and provide that intuitive leap that only humans can currently provide. Over time, though, the next 15 years, by 2040, clearly many jobs will be automated out of existence because AI will be so much better that humans won't be needed. The creation and advancement of these specialized super intelligences paired with robotics will be wholly disruptive. And finally, as I've said before, this requires us in our careers to be deeply invested in AI and learning it and learning how to use it better and better and better all the time, and to be adaptable because career paths will change and change rapidly as these super intelligences are deployed. So this is huge news within the last week out of Microsoft, and it will start to transform industry after industry going forward. What do you think? Leave your comments below. And thanks so much for watching this video and following the AI Guide. Please subscribe and share. And please support us on Patreon. We need your financial support, which we're getting now every month. Thank you. To grow the channel further. Thanks so much. We'll see you next time. Take care. Bye.